Ear infections. If you're a parent that's new to chiropractic care, most likely you've had to deal with it and deal with it more than once. How do I know that? Because even modern medical literature shows that antibiotics don't work for children's ear infections and only contribute to more recurring ones and more often. Did you know that? So why is it the antibiotic treatment is so widely accepted? Well, the truth is, and as hard as it may be to accept, but don't take my word for it, because again, it's noted in modern medical literature, most pediatricians just don't know what to do and even surrender giving their own children dangerous drugs that don't work. Isn't that sad? So what are you supposed to do as a parent? It's a horrible place to be watching your child cringe in pain. I've been there, and I know. Well, that is why we have Dr. Dennis Kraft here on our show. From diet to chiropractic care and their effects on the immune system, you'll learn what you can do so your child won't have to suffer ever again.
I want to talk to you today about one of the most common ailments that parents seek care for their children for in the first 5 years of lives. That's childhood ear infections. If you're a parent, you've probably experienced this yourself. What causes so many of these ear infections to occur? Well, there's a variety of things, but many of them are due to childhood traumas, maybe as early as the birth process, coming down through the birth canal, perhaps using forceps, perhaps just the rotation of the head of the child while it's being pulled, or maybe even suction deliveries. These types of things can create misalignments in the upper portion of the neck of a child. This upper portion of the neck does have a direct control to the mucus flow of the ears, the throat, and the sinuses. Excess mucus production within these portions of the anatomy will prevent the ears from draining properly. As a result of that, the ears tend to get inflamed and irritated and become infected. I want you to know that it's rarely a bacterial infection. Probably less than 10% of the ear infections a child experiences are bacterial infection. But the most common form of treatment for ear infections is repetitive antibiotic use. In my practice, I have seen this over and over again, and I've had the privilege of working with many parents who have children with recurrent childhood ear infections and are able to get them off from the antibiotics because they're not working anyway. They don't work against viral infections, and get them functioning, get their nervous system functioning to the point where it's not a recurrent episode for them. So what I want you to do is think about how the immune system works. If we develop an infection of any type, the body has an immune response to that, as long as it's unimpeded in its process. If we develop mucus as a result of an infection, it's the body's way of walling off or controlling an irritant where it's at so the body's immune response can treat it at that site. Mucus is not necessarily a bad thing as long as it's part of the immune response. If there's an excess production of mucus due to food allergies or environmental toxins, perfumes, dyes, preservatives, things of that nature, we need to get that under control. But to try to dry up the mucus within the system within the area of an infection is oftentimes allowing that infection to grow and proliferate in that region. So we need mucus so that the body can expectorate that toxin out of the system. How about a cough? A cough is the body's way of getting rid of this mucus and with it the invading irritants. So to suppress a cough is in fact helping to defeat the body's immune response. How about a fever? A fever can be miserable for a child and it can be miserable for the parents as well. No parent wants to sit and watch their child suffer. So as a result of that, as soon as a child gets a fever, we try to give it Tylenol or ibuprofen or something of that nature. Do you know that a fever is the body's immune system in function, in action? And when we suppress a fever, we are in essence shutting down that immune system. Studies have shown, and it's documented in the medical literature, that for every degree a fever raises, the amount of immunity cells that our body produces is doubled. So fever is a good thing. We can't work on trying to break a fever if the body is trying to fight something. Too high of a fever? Yes. But if we're talking about a child under the age of 2 years old, 3 years old, and even on up, as long as it stays under 104 degrees, let that body have a chance to work. I am a parent. I understand how miserable it can be to watch your child be in discomfort. I've had my child come down with RSV. And as a chiropractor, I know the power of the innate being within us and its ability to help these things heal. And I watched my child develop these fevers. I watched my child develop the respiratory distress and become miserable for 2 days. It was the hardest thing that I ever had to do, to watch him be miserable and not try to intervene and make him more comfortable. But I did it. I did it and I adjusted him. Our nervous system is what controls that immune system. Our nervous system is what allows that mucus flow to regulate it. So what allows the body to express its innate intelligence. Our immune system is like a muscle. Have you ever wondered why the people who get sick the least are the people who get exposed the most? Why do doctors rarely get sick? Why do nurses rarely get sick? Why do dentists or teachers? It's because they're exposed all of the time. And when we are exposed to something, our body tends to develop a resistance against it, as long as we allow it to do so. If we go out and we take a drug for every ache and pain and creak and strain and sniffle and sneeze and everything that we're exposed to, we're consistently defeating the body's immune response. We need to allow the body to function. We need to release the interference within the system and allow the body to function. Get rid of the toxicities. Avoid the sugars and the fats and the dairies and the wheats and the chemicals that we're all exposed to on a regular basis, and especially our children. Instead, feed them pureed fruits and vegetables and whole food supplementation, omega-3 fatty acids, maybe probiotics to rebuild the intestinal flora, especially if they've been on antibiotics. Our gut, our intestinal system is 80% of our immune system, and when we take those antibiotics, they kill all of that good bacteria as well as the bad bacteria that may be in our system, so we need to replenish this. I've had children, as I said, that have been on antibiotics for 7 straight years, prophylactically every day, because every time the parent would take them off from the drug, they would get another ear infection. And as a result of that, she finally decided to bring them into my office. And literally within 2 months of chiropractic care, relieving the interference on the nervous system, reworking the immune response, rebuilding the nutritional system within the body, the child never had another infection. I can go on with story after story about how childhood ear infections are improved with chiropractic care, as long as the parents understand the concept and try to take away the irritants as well. Mothers, if you're nursing, don't put your baby on its side, on the same side all of the time. Some of the bacteria or the viruses in the mouth can run into the ear. Don't ever lay your body or your baby on its back with a bottle in its mouth. Their eustachian tubes are oriented so that they have a direct connection to the ear, and it allows that contaminant to drain down into the ears. It's simple things that you can do. So I know you're all chiropractic patients if you're watching this. I know that you have children, and I know if you don't have children that you know people who do, and most children come down with these ear infections. So seek instructions from your chiropractor, seek care from your chiropractor. Let's help these children grow up to be healthy in every aspect of their lives. Thank you.